Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Now that you three have your braces on, how would you like to take an orthodontic trip?
Yeah. What do you mean? Where does it start?
Well, it starts right here with this pair of jaws.
Wow.
Yeah, those are really big ones. Well, let's talk first about the jaw relationships. In other words, how the upper and the lower jaws come together. Yeah, Melanie.
I noticed that the upper jaws are a lot bigger than the lower jaws. How come is that?
Well, that's true. The upper jaw is bigger and does kind of fit a little bit on top of and over the lower jaw. Okay? And this is so you can chew. And notice, too, that the lower jaw is able to move around.
Why does it move around?
Well, this moves around so you can chew. In fact, why don't you try yourself? You can see how just the lower jaw will move around. Can you do that with your mouth? Right, very good.
How come just the lower one can move and not the upper?
Well, the upper one is fixed to the rest of your skull. It's kind of like a hammer and an anvil. The anvil stays stationary while the hammer comes down and beats on it. Okay? So that's your lower jaw is like a hammer. Okay? Now you can see, too, that the teeth all fit together nicely. Right?
Yeah.
Okay. And they're designed kind of like the wheels of a gear. And that means that all the gears come together and intermesh within each other very easily. Yes?
What would happen if one of the teeth were lost by decay?
Well, let's talk about that in a few minutes. But let's just talk a little bit more about the way the teeth come together, okay? You had a question, Melanie.
Yeah. So I get it. All the teeth are in a nice straight line, and they don't, like when your upper jaw comes down on your lower jaw, they don't ever bump in the wrong places.
Right. And this is what we call occlusion. They don't clash together. They come into occlusion. And this is a word that we use in dentistry. Now, your question was what we call, pertaining to at least, what we call malocclusion. Okay? And this is where, let's say a tooth was lost by decay, like what you said. And if the tooth were lost by decay, then the other teeth around it, because they depend on that tooth that was lost for support, may collapse in. And again, we'll get a malocclusion, okay? Mal means bad, malocclusion. All right? This can give us a bad bite or malocclusion. Yes?
So one tooth depends on the teeth next to it.
Somewhat. The teeth are also supported by the bone and the gums that surround it. But they do depend on the other teeth, and this is one of the reasons why you don't want to lose teeth. And this is what causes the malocclusion. Okay, there are many different types of malocclusions, though. In fact, let's look at a couple of other types of malocclusions which aren't from teeth being lost, but are just inherited or due to the person's environment, one of those two factors. Okay? Yeah.
If you lost a tooth from decay and then it was out, would all the other teeth fill in that space and be sort of off balance?
Well, sometimes they will tip into the space, and they will be off balance. And again, this gives us our bad bite. Things aren't equal. The gears don't intermesh properly.
And would you have to get one pulled so that they go back equally?
Well, that depends on the different types of dental treatment that you might have, okay? Let's right now take a look at those different kinds of malocclusions. And these are malocclusions that particularly pertain to orthodontics. And the first one you can see here is where there are too many teeth or too much tooth mass for too little jaw size, okay? Too much tooth for too little jaw. And you can see there's what? A lot of crowding, correct? Yeah, there's lots of it in there. Yeah, Melanie?
It sure would be hard to brush then, wouldn't it?
It certainly is hard to brush, and this is one of the reasons that decay starts, when teeth are all crumbled together and you can't get your toothbrush or your dental floss in between there. In the second one, we can see where we have a large amount of overjet. Okay, overjet is a space between the upper and lower teeth. Normally, the lower teeth should be close to the upper teeth. They should fit about like that. But now, in this patient that you're looking at, you can see the upper teeth are way out over the lower teeth. That's what we call too much overjet. Okay? The last one we see here is too much overbite. Again, we have the front lower teeth and the front upper teeth. This time, instead of being out too far, the upper teeth are down too far. And you can see that you can't even see the lower teeth, or at least just maybe a little bit of the lower teeth. Okay, it's too far down. We call that a deep bite, or too much overbite, one of the two. Now, there are many different types of malocclusions. These are just a few of them. But orthodontics takes care of many different types of malocclusions. Are there any questions? More? Yeah, Melanie.
Maybe after a while, could we see our malocclusions?
Yeah, in fact, why don't we do that right now? Why don't we take you into the other room, and we have some equipment in there that will allow you to look at your teeth and really check out your own malocclusions. And then afterwards, we'll have a little quiz where you can write out some of the things you've found. Does that sound good?
Yeah.
Okay, great. Let's do it. Okay, Bart, now you can use the mirror here that we have with the special light underneath it to look inside your own mouth. So take here and look at your front teeth first of all. Oh yeah, now you can see inside pretty well, right? Mm-hmm. Good. Now you can also look further inside by using the little pen light with the mirror attached to it and getting right inside your mouth there. See the side teeth. Okay,
Wow.
Close together a little bit. Oh yeah. Okay, now you can see what problems you have as far as a malocclusion, or at least have some idea of it. In a few minutes, I'll be giving you a questionnaire that you can fill out, and you too can fill out your questionnaire and discuss it later with your hygienist or dentist.
Isn't it neat that they can correct malocclusions?
Yeah, I think it is pretty neat that you can correct these malocclusions because there are many different types of malocclusions, and each one has a different type of treatment too. Well, let's talk a little bit about these malocclusions. In fact, let's talk about that person we had before with all the crowding. Remember that one?
Yeah.
Mm-hmm.
Okay. That person was sort of like an elevator with too many people inside it. They're all scrunched together, and none of the teeth or the people have any room to stand and move around. So we can do a couple of things. One is we can take some people out of the elevator, and the other is we can have all the people go into a larger elevator. Either way, this will kind of cure the problem.
That's just like when they took out a few of my teeth. Didn't seem to make my mouth any bigger.
Yeah, and how do you make your mouth bigger?
Well, taking the teeth out of, or removing teeth from a patient is kind of like removing some people from an elevator. But there are many other methods, too, that the orthodontist uses to allow him to correct the malocclusion.
So that's when you use braces?
Right. That's when we use orthodontic appliances or braces and to treat these malocclusions.
But you said appliances, and that sort of sounds like you're going to stick a washer or dryer in your mouth.
Well, these aren't exactly the same type of appliance that we're talking about. Here we're talking about very precision materials that are placed on and about the teeth that enable the orthodontist to move them around in a very controlled way. Okay? In fact, I'd like to talk to you a little bit about these appliances and tell you a little bit about the components of them. First of all, let's discuss the bands. These bands are round, and as you can see, and they slip over the tooth, and they're made out of stainless steel. Yeah.
But how do they stay on your teeth?
Oh, Well, they stay on the teeth because they're fitted very closely to the tooth, and then just when the orthodontist is very satisfied with the fit, he cements them or glues them onto the tooth. Okay? Each one of these bands has placed on it a bracket, and you can see those too. Do you see the brackets there? Okay, the brackets then are what are used to hold the wires in, and the wires do a lot of the moving of the teeth. And they're made out of stainless steel too. Okay, these wires go all the way around the arch, and they're called arch wires, strangely enough. Okay, can anybody think of any other orthodontic appliance that you've seen?
Headgear?
Yeah, headgear, Jenny. The headgears come in a lot of variety of sizes. I think you've seen in different types, and they are also used to move the teeth around and are very effective.
With all those gizmos in the way, isn't it sort of hard to keep your teeth clean?
That's right, Melanie. It is difficult to keep all those gizmos clean. In fact, that's the next part that we're going to on our orthodontic trip. But right now, let's go in the other room, and with the use of the light and the mirror, let's take a look at all the different parts of our orthodontic appliances now, so you can identify them and know what they're all about. And you too can take a look at your orthodontic appliances and then fill out your questionnaire and discuss it with your orthodontist or your hygienist. Well, we've reached an important junction along our road to our orthodontic trip here. You can see here we have two roads, and one fork leads toward good oral hygiene and the other fork leads toward poor oral hygiene. Okay, now this choice is critical to your success in orthodontics. It takes a lot more effort to keep your mouth clean when you have braces on. It's sort of like the simple buckboard wagon. Okay, the simple wagon with the nice clean lines is easy to keep clean. But in this old peddler's wagon with all the material, pots and pans hung on the outside and the inside, it's more difficult to keep it free from dust.
Yeah, I could sure see how somebody could get some some food caught in your braces pretty easy.
Right, it is easy to get your food trapped in your mouth when you do have braces on. It gets under the wires and under the bands.
It must be really hard to clean way in the back.
And the back is an especially hard region to keep clean. It's sort of like people's houses. Their living rooms they keep real clean because you can see it. But their closets they don't keep clean because they never look inside their closets. So you've got to look inside and see those back teeth, because if you miss those back teeth, a lot of damage can occur.
What kind of damage?
Well, the damage comes from decalcification and decay.
It would really be sad if you had to go through all that orthodontic work for nothing.
Right.
What causes tooth decay?
Well, the tooth decay is actually caused by millions of tiny bacteria, and these combine with food and saliva to form a substance we call plaque, and it looks like this.
Wow, it looks like there's a lot of bugs or bacteria on the teeth. I'm sure, or at least I hope I don't have any.
Well, it's very difficult to see this plaque. It forms a thin film, and you have to clean it off regularly, or it collects on your teeth in a jelly-like mass. Bacteria react with sugar on the surface of the tooth. Acids are released, and then tooth decay results from the action of the acids on the enamel.
It is incredible that those little bitty critters can destroy such hard enamel.
Well, Melanie, I think it is incredible that something like little bacteria can produce something that will destroy tooth enamel. But they produce acid, and acid is a very powerful substance. You know what acid is, right?
Mm-hmm.
Okay, acid, if placed on steel, can even eat away steel. So you can see how powerful the products that these bacteria do produce. These bacteria can also injure your gums too, but this gets more important as you get older.
What happens?
Well, the gums will get red and they may have a tendency to bleed. But for right now, let's take and focus more on prevention.
How do you prevent tooth decay and gum disease?
Well, you can prevent it by removing the plaque regularly. And this can be done by using a soft toothbrush, a water irrigator, and other devices. This, along with visiting your dentist regularly, so he can check you over and prevent any other problems that have started, will have a tendency to keep these diseases low.
Jeepers, I feel like I've learned a lot today.
Well, I think we all have learned a lot today. And right now, let's go out and fill out our questionnaire, and then we can discuss it. And you too can fill out your questionnaire and discuss it with your dentist or hygienist.
Gee, if plaque's so difficult to see, then how do you know it's even there?
Well, plaque is difficult to see on a tooth, Melanie. However, if you scrape some off the tooth surface, you could see it against a dark background. There's a simpler way, though, of detecting plaque, and this is by means of a disclosing solution.
What's disclosing solution?
Well, it's like a dye which is painted on the teeth, which will not cling to smooth, clean surfaces, but which will cling to surfaces which are sticky and gooey, such as plaque-covered surfaces. Look over here at the pictures of children with disclosing solution. See, here the plaque is close to the gums and also between the teeth.
We sure will have more trouble finding the plaque with all those appliances in the way.
It won't necessarily be harder to find the plaque, Bart, but it will be more difficult to remove it. There are some areas which commonly accumulate plaque. Let's look at these a little more closely. See, here between the bands and the gums is a common spot.
I know I have trouble keeping that area clean.
Yes, but unfortunately, if you can't keep it clean, there is a strong possibility that the tooth or involved teeth may decalcify, as we've seen earlier on our trip. Here are some pictures of decalcification in the front part of the mouth. See the distinct white lines where the tooth is decalcified?
Yes.
Let's see how the back teeth look when they decalcify. Here's a picture of decalcification on the back teeth. You see, it's a whole area that's decalcified.
Yep.
Some of you have bands that extend down below the gums. In this case, the bands will protect the tooth wherever it covers it. Now, you can still get decalcification, though, above where the bands are, more towards the biting surfaces of the teeth. You remember also our wings and brackets. These can also be a food trap.
Yes, that would be an easy place to get food caught.
Yes, there are some areas on the front teeth, too, where food can get trapped. It's in the rectangular trap between the arch wire and the flattened tooth surface. Then, on the back teeth, the rounded contour of the teeth provides a triangular trapping site.
There sure are a lot of places where food can get trapped.
Yes. Now then, let's talk a little bit more about the disclosing solution. You need to swish it vigorously around in your mouth and rinse out vigorously, so then it won't stick on any of the surfaces except where the plaque is.
Can we try it?
Sure. Let's go in to the other room now, and I'll introduce you to my hygienist, and then she'll show you how to use the disclosing solution.
This is the solution used to color the plaque. Now, swish it vigorously so that you get it on the back teeth as well as the front teeth. That's right, the inside surfaces as well as the outside surfaces. When you're finished swishing, empty it out and rinse it with water. Now we use this light with a magnified mirror. If you'll use this pen light also to see the inside surfaces of your teeth. Can you notice the red that's clinging to the teeth? Okay, that's plaque. You want to check the back teeth as well as the front teeth again, the inside surfaces, the outside surfaces, and the chewing surfaces. You people can try it too. Use your handout with the chart of the teeth. Color the areas on the chart where you can see plaque on your own teeth. Record the presence of plaque on the outer surfaces of your 4 upper front teeth and the inner surfaces of your 4 lower front teeth. Talk to your hygienist or dentist to see if you are correct.
Now we've reached the point on our trip where we're going to actually learn how to brush our teeth.
Oh, good, because I'm really eager to learn how to get the plaque off my teeth that you talked about. But is just regular brushing okay?
Well, the important thing is to get your teeth clean without injuring the appliances or any of the soft tissue. At any rate, I'm going to get the hygienist and bring her in, and then she'll show you how to brush your teeth.
First thing you need to learn in removing plaque is how to use your toothbrush properly. You should use a soft, multi-tufted toothbrush which has polished bristle tips and a handle which you can rotate easily so that it can adapt to all sides of your mouth.
Can you show us how to brush?
Yes, let me demonstrate here on this typodont. First, you should place the toothbrush on the back teeth and point the bristles towards the gum tissue and the appliance. Then rotate the brush slightly upward so that it's now, the bristles are pointed into the appliance and it's at a 45-degree angulation. Then just use small little circular motions and use this motion about 5 times, then slide the brush forward and overlap the stroke in the area where you had just cleaned. Then when you come to the front teeth, you should point the bristles so that they are directly facing the gum tissue and the appliance. And again, you need to use just these small motions.
Gee, they're just small circles that you're making.
That's right. We're just going to move the brush in small, circular, overlapping, sliding strokes. An important part of brushing your teeth is to have a system. That is, to start in the same location each time and to proceed systematically to the other areas of your mouth. If you already have a system, continue to use it. But if you don't have a system, let's try using this one. Start on the back 2 to 3 teeth and start brushing.
Jeepers, it'd take half a day just to clean your mouth.
Well, it does take a long time, Melanie. But there are 2 things to consider. First of all, once you develop a good habit, it doesn't take as long the succeeding times that you do it to brush them. In other words, the initial time it might take you a long time, but after that you'll get accustomed to it and it won't take so long. The other thing is that the benefits are so fantastic that you really can't afford not to do it.
It's sort of like Jenny said, it'd be really sad if you went through all that orthodontic treatment and you found out that you had decay.
And if your gums are bleeding?
Does it keep your breath clean?
Right, it does keep your breath clean. In fact, that's a good point, Jenny. The thing is, if you're removing the plaque, then your mouth is really clean and really will smell good. But if you are just using something like a mouth rinse, then it's only a temporary cover-up. Let's get back to the system once again. We started here on the back, on 2 to 3 teeth. On the upper right, we move around the mouth to the upper left, and then drop down to the lower left and proceed systematically around to the lower right.
Now we finish with the outside surfaces?
Well, not exactly. You see, on the outside surfaces you have brackets which contain the wings and slots, and you have wires. So there's a lot of places for the plaque to accumulate. So what I would suggest is that you brush around the outside surfaces 3 different times, brushing a different portion of the teeth each time you go around. Where do you think we need to brush next?
On the bands and brackets?
Right. We're going to brush directly on the bands and brackets so that you point the bristles of the toothbrush directly on the bands, brackets, and wire, and the toothbrush is now at a 90-degree angle or perpendicular to the wire. Here you're going to brush in a circular motion so that you're sliding and overlapping the strokes. Again, you're going to proceed systematically around the mouth.
So when I get finished, I go over them one more time.
That's right, Melanie. We're going to brush 3 times around, and this will be the 3rd time. And this time, you should hold the toothbrush so that the bristles are pointed towards the appliance and are on the chewing surface and on the appliance. Then you move the brush or rotate the brush so that the bristles are pointed towards the undersurface of the brackets. This time, you brush in circular scrub motion with overlapping sliding strokes as you go around.
Should this be done in the same system as before?
That's right. We want to use the same system so you don't miss any area as you're brushing. Now the next part of your mouth that you're going to brush are the inside surfaces of your teeth.
There aren't very many catches for food to collect in there, are there?
Right, and so you only need to brush the inside surfaces of the teeth just once. And the way you should do that is to take your toothbrush and place it so that the bristles are facing the gum tissue and the teeth, or are at right angles to the gum tissues and teeth. Then just use small circular motion as you brush each area. Start again on the upper right, brush about 5 times, and then move on to the next area, overlapping your strokes and sliding the brush along the arch. Again, you're going to use the same system as you used before. Start on the upper right, go over to the upper left, drop down to the lower left, and move around to the lower right. Now, do you think we've cleaned all the surfaces of the teeth?
What about the chewing surface?
Right, the chewing surface needs to be cleaned because this is where we have hills and valleys. So we need to place the bristles into those little hills and valleys and brush back and forth, horizontally across the teeth. Again, you want to brush systematically so that you do each area of the mouth.
How many times a day should we brush our teeth?
You need to brush after every meal. And remember, on the outside surfaces, you'll brush 3 times, on the inside at least once, and on the chewing surfaces once. Now, why don't all of you try this so that you're sure that you understand how to brush your teeth when you have appliances on your teeth? Check it out with your hygienist or dentist to make sure that you're doing it correctly.
Well, we've just about reached the end of our trip, except we still have one very important spot to stop at, and it's right here.
Gee, it's a spraying water bath.
Right, Jenny, it is a spraying water bath, but it's a bath for your teeth. I'm going to go get the dental hygienist, and she's going to come in here and show you how to use it.
Okay.
This water bath or oral irrigator is used to remove food particles, and it will help massage your gums.
Hey, then I don't have to brush my teeth no more.
Well, Bart, it really doesn't take the place of the toothbrush. You see, it won't remove sticky, gooey plaque.
It could be really helpful in removing all the stuff between your wires.
It's a good point, Jenny. As a matter of fact, you really should use it after all your meals and snacks.
How does it work? I mean, you could spray food and stuff up in your gums.
Good thinking, Melanie. That's the most important point to remember when you're using it. You must point the water tip so it is spraying away from the gum surface, that is, towards the chewing surface.
Can we use it on all the surfaces of our teeth?
Well, it's most useful for cleaning the outside surfaces where you have the bulk of your appliances, but you can use it for in between your teeth as long as the water spray is going away from the gums towards the chewing surfaces of the teeth.
Seems like a pretty important stop in our orthodontic trip.
Extremely important, Bart. As a matter of fact, it's a must for anybody who has orthodontic appliances. Remember to follow these important directions. Direct the water towards the chewing surfaces of the teeth. Keep the flow at a low or medium force. You need to check the manufacturer's directions for the use of this. Now I'd like to have each of you demonstrate this on the model provided and also to answer the questions on the questionnaire.
Well, we're at the last stop on our orthodontic trip now. This aid and other ones that we're going to show you can be very helpful to you in keeping your mouth clean. After some instruction in how to use them, then you might feel that they will be helpful to you. And if you do feel that way, ask your dentist or dental hygienist if they think it would be right for your type of problem. I'll go get the dental hygienist now, and she'll show you what they are and how to use them, okay?
Okay.
To start with, you'll need about 18 inches of floss. Just cut it off and place it through the floss threader. Here, Melanie, you can use the threader to insert the floss between the teeth and gums. Good. Just pull the floss through with the threader. Now hold on to one piece of the floss and pull the other one through with the floss threader. Wind the floss lightly around one of the joints of each of your middle fingers. Then wrap the floss around the outer and inner surfaces of the tooth, forming a U shape with the floss, like this. Slide the floss into the surface between your gums and teeth. Hold the floss tightly against the tooth and move it up and down, sliding it against the side of the tooth. Good. Now, turn the floss so it is against the opposing surface of the adjacent tooth. Form a U shape and slide it between your gums and teeth. Move it up and down once again. Remember, place the floss around the tooth in a U shape. Move it up and down on the tooth surface, then do the same on the adjacent tooth surface. Proceed systematically around the mouth.
Should we use the disclosing system to check ourselves when we're done?
Yes, you should use the disclosing solution so that you can determine if you have any retained areas of residual plaque. You need to use the plaque removal record to determine if you have been successful in removing the plaque.
What if we don't get rid of all the plaque the first time?
Well, then just keep brushing and flossing until you think you have completely removed all the plaque. And when you're finished, check your success with your dentist or your hygienist.
Is there any way I can make my gum feel healthier?
Well, there are some ways you can stimulate your gums, Melanie. One of them is to use your index finger and just rotate it on the gum tissue back and forth. Now there's another way. You can use a specific type of a device, such as the one shown here.
That's neat. How do you use it?
You angle the tip up for the lower teeth and down for the upper teeth. Now when you place it, you should place the tip between the gums and the teeth and then rotate it slightly until you count to 10. This should stimulate the tissue.
I seem to have trouble getting food caught in my arch wire. Is there anything you can suggest for taking it out or something?
Well, yes, Melanie, you can use this device, which has a brush on the other end of the rubber tip, or you can get simply one device which has one brush on it. Now the way you use this is to place the brush so that it's angled up for the lower teeth or down for the upper teeth. And when you do use it, be sure to moisten it before you use it and then place it between the teeth and move it up and down beneath the arch wire in between your teeth. Now this concludes your stop on additional adjuncts. Now let's ask the orthodontist to come back, and he'll conclude your orthodontic trip.
Well, it looks like we've reached the end of our orthodontic trip. I certainly hope you've enjoyed it.
Oh, we have, and we learned a lot too.
Well, great. Here are a few things I'd like you to remember. Brush after every meal 3 times on the outside surfaces, once on the inside, and once on the chewing surfaces. Oral irrigator. Use after every meal and snack. Point the spray away from your gums. Additional adjuncts: floss, rubber tip, and interdental brush.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.